We'll go to our next speaker, Dr. Nikita Arora. Again, a very important topic, imaging in retinopathy of prematurity.
Good morning, everyone. So my topic is imaging in ROP. I'm Dr. Nikita Arora, and just a brief. With the rise in NICU facilities, the number of babies who develop ROP are increasing day by day. India is in its third pandemic of blindness due to ROP. In India, the criteria for ROP screening is any baby who weighs less than 2000 grams or is less than 34 weeks or has been admitted in the NICU or had a rough neonatal course. Those are the babies who need to be screened. And why screening is so important? That is because if we screen in time, we treat in time, and we save sight. Now, binocular indirect ophthalmoscopy performed by an experienced ophthalmologist remains the gold standard for ROP screening. So what is the role of imaging in ROP? Significant advances have been made in the past 2 decades to increase the viewing angle, speed and accuracy of retinal imaging devices. These devices are popular nowadays for diagnosing, monitoring and treatment of ROP. It helps in better documentation of clinical findings. It helps in better counseling of the parents so that we can treat the baby. That is very important. It can also be used as a screening device by trained paramedics in case of tele-screening when ophthalmologists can't visit every center. So coming to the methods of imaging in ROP, the first method is the video indirect ophthalmoscopy, in which a camera is attached to your indirect ophthalmoscope. And so this is the earliest method. It is the modality with stereopsis, and you can change the magnification and field of vision by using different condensing lenses. So advantages are that it is cost effective, it is handy, it is wide field as you can indent up to aura and see and record. However, it does need good indirect ophthalmoscopic skills. Prolonged indentation can be stressful for the baby and you can't perform FFA. So coming to the contact fundus cameras, these include cameras like RetCam Shuttle, Phoenix Icon, Panocam, Trinetra Trio, etc. So the advantages are that you can use in different lenses and take anterior and posterior segment images. You can perform FFA in some of them. They are relatively baby friendly with less systemic fluctuations and can capture up to 100 to 130 degrees of the retina. However, it needs practice. The probes are heavy and sometimes the mobility is restricted, especially when you wish to image the zone 3 area. It is difficult to move around except the RetCam Shuttle and the Forest Trinetra Neo. And they are very expensive. Coming to the non-contact fundus cameras, they include the Optos and the Claris 700. Advantages: it is wide field. It has faster acquisition of pictures with a single click. There are no fluctuations in the baby's parameters. However, it needs training as you need to hold the baby in a special flying baby position. They are expensive and not portable. And there are artifacts like eyelashes, eyelids and speculum. So coming to the smartphone cameras, smartphone photography has a lot of potential, especially in low resource settings. It is basically a device connecting the phone and the condensing lens. It has a reasonable sensitivity and specificity. Coming to the options that we have, it includes MI2 RetCam, Pexoscope, Retinoscope, etc. Advantages: it uses 20D lens, it is non-contact, it gives you 46 degrees of view, it is portable and less expensive. Shortcomings: like any other device, it needs training, it is difficult to capture anterior segment pictures and needs attachments for lenses other than 20 diopter lenses. However, all these devices are expensive and you need to shell out some money. So what can budding ophthalmologists do for this? So I am going to tell you a method in which you can capture pictures without using any attachment. So what do you need? You need, like any other ROP screening, the pupil needs to be dilated, media needs to be clear, the condensing lenses, which you can use any lenses. You need a smartphone with built-in for working flashlight and screening instruments. So what is the procedure? In this, when you are screening your ROP baby, like dilate the patient, position the baby, anesthetize with proparacaine eye drops, open the lids with help of your speculum, examine the patient using indirect ophthalmoscope and your lens. So that is the first step that you do. You examine the baby how you usually do. And once you have found the area which needs to be captured, you keep your lens in the same position. Now lift your indirect ophthalmoscope head, bring in your camera, switch it on video mode and switch on the flash. And instead of the light coming from the head of your indirect ophthalmoscope, you use your camera and put the light on the condensing lens. This is what you have to do. These are the iPhone settings, as I have an iPhone. So first you switch on the camera, go to video mode, then you switch on the flash. Then lift your ophthalmoscope head like I have done in the second last picture. Put your phone's flashlight on your lens, and this is the picture you get. Now you're not supposed to, the thing that you have to remember is don't use your picture mode, you use your video mode. So you record, like ma'am had mentioned in the FFA presentation, that you take the entire video and then you screenshot whatever shot that you need. So this is the picture of aggressive ROP that I had taken in one of the babies. So what are the advantages? It is cost effective, it is handy, because everybody has a phone, everybody has a lens, whosoever is doing ROP, and it definitely helps in patient counseling. However, shortcomings, like all imaging devices, it needs practice. It is not wide field, but you can capture the periphery with the help of an assistant. Now I'm going to tell you how to do that. Your assistant can either put your flashlight on the lens and you're already indenting and your lens is in your hand, or the assistant who is very trained can indent a bit without putting too much force. So this is how you use an assistant to capture the periphery. And another shortcoming is you can't perform fundus fluorescein angiography. So these are the few pictures that I've taken, few of them, showing plus disease, aggressive ROP, freshly lasered ROP. The second and third are from the same patient. This is stage 3 ROP. This was in stage 3, zone 3. So with the help of an assistant, you can go up to, like, not extreme periphery, but yes, you can take the junction of zone 2 and zone 3 and aggressive ROP. So to conclude, taking images helps in better documentation and also increases the parents' understanding of the disease and helps us in treatment counseling. Thank you.
Thank you, Dr. It was a very nice presentation, and those images are, I would say, in no way less than webcam images. Very nice. And how much of practice do you think it needs?
I started during COVID time. These all pictures were taken during that time now. I'm relatively busy over there, so I don't take that frequently.
One thing I didn't understand was you said you make your assistant depressed because these babies are so much fragile.
And that is why I use the word trained assistant, not
and I think you should monitor with pulse oximeter once you are doing indentation, otherwise you could land up in problems.
Definitely, but that is why I usually give my phone to the assistant. I don't really make them indent.
Okay, so you will indent?
Yeah, I will indent. I will hold the lens and they can put the flashlight on my phone. That pre-retinal hemorrhage was my assistant holding my phone and I was indenting.
So it doesn't have to be in straight line?
It doesn't, right? On your, whenever we are doing indirect ophthalmoscope, we know when we are in the right plane because the light returns below. Yeah, but you can see it from outside how it is coming on your eye, and then you can just ask them to move forward and backward. It takes practice, I don't deny, but it is cheap.
Yeah, that's very nice.
I think you can use that app also. In app you will have that circle. So in all your photographs you are those fingers are there now. So that circle is there and it will crop out that image. You can
I have the MI2 also.
Yeah.
I have Forus also.
Yeah.
I have both of them now. But when it comes to training, like how much time it takes to take the image, learn how much it is. I don't think so. It took me more than
because in that app, that whole settings are there. Like you need not go on the flash. You just open that